So, as a doctor that works in a high security mental health facility, there's a couple of presentations to hospital that we see very regularly. Uh, Treatment resistant mania, psychosis, treatment resistant depression, and often behavioral problems such as suicidality, agitation, or aggressiveness in people who have personality vulnerabilities. Many of these people will have developed these personality vulnerabilities secondary to developmental neglect or trauma. And so that's the topic of this video. And I hope this video kind of gives a bit of empathy towards people you might not like, narcissism, agitation, aggressiveness. These are all defense mechanisms that have developed secondary to, uh, you know, pretty good reasons usually in people's development and because of their genetic predispositions. So the first part of this video will cover what happens in the brain in developmental trauma or neglect. We'll then cover the normal development of what a child's brain should go through and the attachment styles and how that affects how adults develop. We'll talk about what happens when that goes wrong, and we'll talk about the abundance of treatment options that are out there, which are not just medication and therapy. There's lots of other things that are very helpful for people who have, traumatic upbringings and have developed unhealthy coping mechanisms and things like that. So that's what this video is all about. So what happens in your brain when you're experiencing a traumatic event? Well, essentially, you have to understand the concepts of fight, flight, and freeze. And people are pretty familiar with that concept. At least they've experienced it at least a couple times in their life. There's essentially the nervous system can be broken down into different categories, but there's a sympathetic and a parasympathetic branch of the, I guess you could call it unconscious nervous system, the autonomic nervous system. It's a bit more complicated than that because you can consciously control it. But essentially, I say it's unconscious because you cannot control easily when it is activated. So, for example, if you see something that scares you, if a tiger leaps out of a bush, or if someone attacks you with a knife, without unless you're incredibly well trained, you really won't be able to choose your response. You will have an increase in heart rate, an increase in blood pressure. Blood will pool into into your limbs and where the muscles are, and you will either fight or flight or run out of there, or if it's very, very disabling, you will freeze. That's kind of the extreme. So this is the sympathetic nervous system response. It's really the neurons are activated by noradrenaline. Adrenaline is released, and it feels kind of gross. If you've had an adrenaline rush, you notice afterwards you feel kind of gross. You just feel like sick because you've had this flooding of adrenaline, cortisol, and stress. And your body is very agitated. You want to do something, you want to move. And really, that's the goal of this sympathetic response. It's to activate movement. And that's important to note because a lot of people who get agitated, overwhelmed, and get into fight or flight states because they're having PTSD, they don't move. They sit still. They kind of, they're trying to kind of suppress the response. Uh, it's very hard to suppress this emotional level of response. And the reason it's hard to suppress is because if you think of the brain, there's kind of three layers. There's the brain stem, and that has all the kind of unconscious, basic life support nuclei that monitors your heart rate, your breathing, your hydration status. That's where all the kind of the neurons are that kind of monitor all that. Then on top of that, on top of the midbrain and brainstem, you have the emotional brain, the limbic system. This is, if the brainstem is the reptilian brain, the limbic system is the kind of mammalian brain, the mammal's brain. So, a lot of mammals have lots of emotions, and this is where the amygdala and hippocampus and limbic structures are, which kind of activate the fight or flight response and can be extremely powerful. And from the amygdala and into other brain structures like the third layer of brain, the cortex, the neocortex, which is really the layer of brain where the higher level cognition is occurring. This is what makes you human. This is your personality. This is the part of your brain you're using when you're telling yourself to calm down. That's using words. That's Broca's area. And you're trying to use the cortex to, if you're very agitated, to suppress the emotional brain underneath it. And that's very good. That's what you want to achieve. But some people Like that takes a lot of training and a lot of time. And if you haven't, gotten the words to describe how you're feeling, a lot of people find it hard to use words to describe how they're feeling. Um, it's very hard to use that cortex to suppress the actual, like the prefrontal cortex where your thought are. It's hard to use that to kind of suppress the emotional fight or flight response. And the reason is there's actually neurons from the amygdala to these higher brain structures that are inhibitory. They turn the higher brain structures off. That's why you cannot reason with someone who is trying to stab you or attack you or run away from you or having a panic attack, or it's very hard to use words to reason with someone who's extremely emotional. And this will lead to the third section. Just remember this, because we're going to talk about the third section, about treatment options, where there are non-verbal ways to treat emotional dysregulation or emotional agitation and aggressiveness or whatever. Uh, you need to find things that don't use the higher kind of prefrontal cortex areas. You need to use movement a lot of the time and deep breathing. And the breathing in these movements, they help activate the other side of this unconscious nervous system, the parasympathetic branch of the autonomic nervous system. And this is the cholinergic side, as opposed to the adrenaline side. And the parasympathetic nervous system is the rest and digest. Okay, this is the calming side of this is what you're activating when you're meditating. It's very pleasant. And if you think about it, the sympathetic response is really about using energy, and the parasympathetic response is really about conserving energy. And the goal is not to have one or the other. The goal of all life is homeostasis. It's about the balance. It's fun to play sport and have a bit of a sympathetic drive, and then it's fun to watch a movie and have a more kind of parasympathetic drive. But what happens in the brain when there's a traumatic event, some horrible thing? And this can be sexual assault, this can be violence, this can be watching a natural disaster, losing a home, losing a loved one. Trauma is endless, and it's about perceived trauma. So something that is traumatic to one person might not be traumatic to another, and that's why in one, the same event, one person might get PTSD and the other not. And there's also genetic factors there as well. But what's actually happening in the brain? So, as we said, the limbic emotional brain with the amygdala triggering the fight or flight response. That's what's happening. But 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 why do people get PTSD? Why does that? I've met patients whose traumatic event was 40 years ago, and every day they go back to that traumatic event. Like, they do not continue in life. They keep coming back to that moment. And that's because the brain area, the hippocampus, which is this brain structure right next to the amygdala, they're best buds. This is where kind of memories are formed. And evolutionarily, this makes sense. You want to have emotionally stressful things. You want to remember them, because if you're, in a hunter-gatherer society and you're hunting for something, and then a tiger attacks you and you have to run away to survive, you want to remember that. You don't want to forget about that and then get eaten by the tiger the next time it attacks you. So that's why the memory formation center and the kind of fight and flight center is right next to each other. But when the memories of something that is traumatic get really, really strongly ingrained, because it's a very emotionally arousing, emotionally intense event, then the problem is that you can get re-triggered very easily. And that's what PTSD is. It's the re-triggering of that fight and flight response from a traumatic event in the past. Now, when you're having the fight and flight response, that amygdala activation, very interesting things happen in the brain. Like there's inhibitory circuits to the language center of the brain, the Broca's area, to the ventromedial prefrontal cortex, which is the ability to sense yourself, and the thalamic regions of the brain, which is the ability to sense your body. So people really get intense flashbacks where they are disembodied. Okay, they're not connected to the present moment. They're not there because they're in the memory, because when you do a scan of their brain when they're having a flashback, those are the areas of the brain that are lighting up. The actual areas of the brain that would use words and say, I'm sitting on a chair, I can take deep breaths, those are all being inhibited. But there's hope, right? This is what treatment is all about. It's about re-engaging those other areas of the brain so that you can treat the panic attack. So now we've talked about the neurobiology and the neuroanatomy of kind of what happened in a traumatic event. It's worth now thinking about, well, what's normal development of a child, and what happens when they are traumatized or neglected? And I group developmental trauma and neglect together because really, when a child is in need of a caregiver and they are neglected, that's quite traumatic. Now, when we're talking about development, I think it's good to know what is normal development, and there's no such thing as 100. Everyone's different. Uh, so, so I guess all I would say is the key ingredients to normal development of an individual to develop a secure attachment style, which we'll talk about in a second, is consistent love. Like they need to be able to have a source of consistent care that they can depend on, and a safe environment. So a place where they feel like they will not be in acute danger. So that's development extremely simplified. I recognize it's much more complicated than that. And the key thing to remember when I'm saying those things, first of all, I don't have any kids, so what do I know? This is the first thing. This is all from a textbook and my work with patients. But the other thing is it's all about being good enough. Okay, perfectionism is you don't need to be perfect parent, and in fact, it's better to be imperfect because what you're trying to do in parenting helping a child develop is to get them ready for the real world, and the real world is imperfect, and imperfections in parenting do help build resilience to a point. You obviously don't want to go overboard and give no love and have no safe environment, and when that happens, when there's issues in the consistency of caregiving and love and an unsafe environment, you can get issues in attachment. I mean, you've got to remember when we are born, we are completely dependent. Okay, there's no such thing as an independent baby. They are 100% dependent. And that is the start of attachment. So the first stage of development is for a baby is if I cry, do good things happen? So and that is essentially saying if I ask for help, can I trust the environment that I'm in that good things will happen? If a baby is neglected or abused, then they are learning that when they make noise, when they ask the world to support them, bad things happen. And that can be the start of an avoidant attachment style. Now, not all avoidant attachment styles are pathological. I'm kind of going to extremes here, but you get the gist. I'm just using the extremes to make the case of how an avoidant attachment style can develop. But if they're severely neglected and they want care, but they can't ask for care, and sometimes they get care and sometimes it's inconsistent, then they will develop an inconsistent attachment style where sometimes they will be avoidant, sometimes they might be dependent. But the worst in kind of developmental trauma and neglect is when a caregiver is the perpetrator of trauma. So in people who have kind of recurrent sexual assaults from family members or from a caregiver, that's very problematic in the development of that person's identity because when you're a baby and you're depending on your caregiver, they are idolized. They are kind of God. Nothing can be wrong with them because they're the ones who keep you alive. And so if they're the ones perpetrating trauma onto you, then then it must be you, right? That's the cognitions that happen. What's wrong with me? And then that's where you get the start of really, you get personality splitting, where you can get into dissociated states, and different people can get dissociated identity disorder, and essentially they start having fragmentations of their self. Where they think, there's the self where dad is happy with them, and then there's the self where dad is angry with them, and that's two different parts of an individual, and then that starts causing fragmentation and dissociation and that kind of thing. I guess dissociation is more a defense mechanism when they're going through a traumatic experience, um, but it's all it's helpful defense mechanisms at the time, which make for maladaptive or unhelpful defense mechanisms in the future. So you don't want an adult to have multiple personalities and dissociative fugue-like states where they can do things and not remember it. You want an integrated individual who has a good sense of their autobiographical narrative. And when you are traumatized, it breaks your ability to form a narrative because it inhibits the parts of the brain that, like, the fight and flight response that is getting triggered all the time. It's inhibiting the parts of the brain that can form a timeline of your life. And just to take that tangent on, what is a self? I've been talking about fragmentation of the self. I mean, the self, as I see it, is two parts. It's the autobiography narrative the story of your journey till the point of time. That's part one. The second part is the point of time. It is the physical state in which your body is in. And it's very physical. Yourself is not just a cognitive thing. It depends on you being in tune with your body and being present. And that's why mindfulness is so good, because it brings you into the present moment. And in traumatized individuals, both those selves, the autobiographical narrative and the ability to be in tune with your body in the present moment, they're both affected by the trauma, because when you are re-experiencing a trauma, you go back to the moment of the trauma, right? You keep going back into that fight or flight state that you experienced. So if you have PTSD, you're getting thrown back into the past, so you don't get the development of a narrative or an autobiographical self. And it's also very disembodying, because you're getting a flashback which puts you into the past. So you can't be in touch with your present self. And you can see that in brain scans. So PTSD and complex developmental trauma really block the development of a self. And that's why sometimes when I'm speaking to a 40-year-old, they're regressing into a 13-year-old attitude, because that was the age where the trauma had occurred, and they never really got through the developmental kind of stage of teenagehood. So let's talk a bit about the treatments for traumas then. We've talked about the neurobiology, what happens in the brain. We've talked about how it affects people in their development. I guess now we're going to talk about the treatments. It's important to say that everyone will have their own cocktail of different ingredients in their treatment regime. Some therapies work well for like the PTSD like when people have an individual traumatic event in their life. Um, Therapies work better for that. Some people will have therapies that work better for the complex recurrent trauma that they might have had in childhood, but there is no one size fits all. It's important to try lots of things and to really try them. Don't just try one session of I don't know, EMDR, which we'll talk about, and then call it quits and say that was weird, it's not for me. So you need to keep an open mind, which I get it. I get that's hard, easier said than done. But I think maybe for this period, this stage, I'll say that um, the book, here it is, The Body Keeps the Score, it was very useful in how I conceptualize the treatment of trauma. So when we're talking about treatment, it's important to have goals. And so the goals of treatment, as per this book, The Body Keeps the Score, is the following. It's one, finding a way to be calm. Okay. And then number two, it's finding a way to be calm and maintain calm even when you're being triggered by thoughts or past experiences or flashbacks. Okay, that's stage two. The third is finding a way to be fully alive, to enjoy life, to connect with people, and to be present. And then number four, the fourth one is not having to keep secrets from the self, including ways the person has managed to survive. So this is about kind of knowing yourself, knowing your defense mechanisms, knowing what you have repressed and suppressed, and engaging with them and being your friend. There's an expression, you got to befriend your trauma. You know, and that's very intense for people to hear. So it's not going to happen overnight, but over time, as you become comfortable in yourself, you can. So now let's talk about the top-down and the bottom-up strategies that can help achieve these four goals. Top-down strategies, where most of the treatment is kind of using the brain to control the body. So when you get a fight or flight or freeze response, we try and use the brain to respond to that. And that is using medications and therapies. So in terms of medications, often you might see selective serotonin reuptake inhibitors or serotonergic drugs, and they can help with the blunting of extreme emotions. And so people can find that very helpful, but some people don't. And I think psychiatrists and doctors like me will often overvalue the role of medication, and then psychologists or counselors or therapists will undervalue the role of medications. But the truth is in the middle. We need lots of options, but definitely for extreme distress, there's nothing that can help like a medication when it is extreme. But definitely in the long-term treatment of things, you want to focus on non-medication options a lot as well. So yeah, you'll see kind of serotonergic drugs. You might see things like prazosin or anti-adrenaline drugs, noradrenaline drugs of the brain to help with nightmares. You might see Valium or kind of benzodiazepines to be used in the treatment of panic attacks, which you've got to be cautious about. You've got to be very careful with the use of benzodiazepines. They're addictive. You develop tolerance, et cetera, et cetera. So you've got to talk to your doctor if it's appropriate for you. I'm not recommending or not recommending them. I'm just saying that's something you'll see in the treatment. And then in therapy, depending on your developmental neglect, trauma, or if it was was it a single event or was it a recurrent event, or what works for you. People often start in DBT or CBT. DBT, dialectical behavior therapy, is about developing skills to handle trauma, and CBT is about kind of identifying unhelpful cognitions and developing strategies to kind of pick up that you're in a bad state and how to improve it. Um, and these have pretty good evidence bases. They do help. And there are other therapies that are making like a big comeback. So like EMDR, eye movement desensitization and reprogramming, is a very interesting therapy that has pretty impressive evidence to help people with PTSD. It doesn't work as well with developmental trauma. It's more for people who've had a single, very acute traumatic event. And there's something like it's not fully understood why, but there's something about moving your eyes that puts you in a REM-like dream state, and you come up with the quirky, like you integrate it into your autobiographical narrative better so that it becomes a memory rather than a flashback. And not only desensitize to it, but yeah, place it as a part of your life rather than an active experience in your life. So very odd. And then people come up with kind of imaginative, funny, quirky solutions to their trauma, like a big baseball bat to hit away the nasty perpetrator. Weird things that you might get in a dream, you can get in an awake state, and that helps kind of desensitize to the intensity of the flashback, which is very interesting and odd. I haven't trained in it, but I think I will one day because it looks like a really good therapy. This is very common in mental health, by the way, that we have treatments that work and we don't know why. It's like the brain is just so complicated. We're not at the point where we can understand the mechanisms of everything we do. So we just try things out and then we find things that work like this. Another type of therapy is internal family systems therapy, where you identify different parts of your personality and how they're interacting, and you work with them like, as if they're different individuals. Which is an interesting approach to kind of split your identity and work with them and kind of navigate your inner world. But has good evidence as well. And then the last top-down therapy we talk about is neurofeedback, which has not taken off yet, but has pretty good evidence and seems pretty simple to do. It's more in, it's not just a phone call. You've got to put a kind of EEG head piece on, and you have to watch a screen, and you have to kind of get into a brain state. It's kind of like meditation, where you get into a kind of state of relaxed focus, and then the computer can register your EEG pattern on what's being placed, the dots on your head, and rewards you for that by by like a computer game. Like if you're doing a horse race, if you're in the right brain state, the horse will kind of be winning. And if you kind of get out of that brain state, your horse will lose and the other horses will win. And so it's training you through neurofeedback to to place yourself in this kind of relaxed, focused attention brain state, which is also very helpful for people who have maybe disorganized emotional dysregulation responses. It helps develop the muscle. It's not really a muscle, but the yeah, like a muscle, it trains your brain to get into a state of focus and calm. So that's a top-down option. So what are the bottom-up options? Well, bottom-up means movement, guys, and whether that is deep breathing, focusing on the exhale, the parasympathetic drive. Breathing works. It's about whether it works. You just got to keep training it. It is a skill. You got to use it with other things. But breath work is very important. Don't give up on it just because it didn't work once or twice when you had a panic attack. Yoga works. Yoga is fantastic because it puts you into your body. You have to understand how your body feels and fits and moves. So yoga couldn't encourage it strongly enough. Also, kind of animal therapies, working with horses, equine therapy, or a dog. There's something about having another mammal that gives you kind of non-verbal attention, which works really well for people who don't want to use words to describe how they feel, to connect to another animal that is kind and engaged with them and attuned to them. Attunement is a very important concept. It's about existing in the mind of something else. So when a parent is attuned to their child, the needs of the child, the experience of the child is in that parent's mind, and that makes the child feel like they exist. When you have a neglectful kind of relationship, where for example, if a parent has schizophrenia and is not based in reality, and they have delusions and psychosis, then that child won't feel like they exist. They won't feel they have a self because they've never existed in the mind of their primary caregiver. And so that can develop, very cluster B vulnerabilities where they panic and they feel abandoned because they don't really, they have a sense of emptiness and that kind of thing. But anyway, on to more bottom-up therapies. Other things of movement. Theatre, doing improv theatre has actually had pretty interesting evidence to help with people who have developmental trauma. And dancing and movement is also really useful. You can also check out Pesso's psychomotor therapy, where it's kind of like improv, but there's the director is the kind of client, the patient, and they get people in their life, and they have to improvise certain lines, and they reenact traumatic events and things like that. So I guess my point is there's a lot of hope. We didn't even talk about psychedelic assisted psychotherapy, so there's also that happening. So there's a lot going on in the treatment of trauma. It's incredibly common, and it causes a lot of problems in the world because a lot of nasty people or senior politicians who can control how the world moves, narcissists and antisocial people and people who are explosive and impulsive. These are people who have had developmental neglect or trauma, and so if we have better treatments, we can kind of make the world a better place. But as I said, there's a lot of treatments there. It's about using them and finding the cocktail that fits for you. That is it for this video. If you enjoyed it, please support the channel, engage with the video, like, subscribe, all that good stuff, share it with a friend. If you have questions, put them in the comments. I'll make a video responding to them. And yeah, I'll see you in the next video. Thanks so much. Bye.